Hey, Lorenzo, how you doing?
Hey, all is well. I'm glad to be here. Thanks for the opportunity again.
I am so excited for us to have this conversation. We met over LinkedIn, probably. How many people
Yeah.
meet that way? And I kept saying, oh, man, we have to talk. We have to meet. Like this whole thing you're doing is so cool. But before I venture that far, why don't you introduce yourself and tell people who you are?
Yeah. So, I'm like I said, a country guy out of Arkansas. I think a lot of that really ties into, who I am, and some of the similar pressures that people in the South experience, we think about the civil rights era and, how mental health and depression ties into that, stress and,
Mhm.
inequities. And the work that I do is really tied around mental health and supporting Black men. And I like to start off that way because I believe people in the South have very unique challenges. I think we all as Black people have very unique challenges. And I think when you consider the civil rights era and some of the things that, really happened in the South, I think a lot of our
Mhm.
work really is tied to, really liberation and really seeing the full strength and opportunity. And so, the Confess Project is what I do. And what is the Confess Project? We're a national grassroots organization that's focused on mental health, particularly for young Black men and boys between the ages of 6 and 35 by training barbers to be mental health advocates, supporting young Black men and their families. That's the work that we're doing at large now across 40 cities. We train about 1,000 barbers. So I'm really excited for that. And it's really started as my own story, my own journey.
Mhm.
And it's really rippled now into a magnitude of opportunity and movement building for Black
Yes.
men and boys. And so really excited for that.
Yeah, it's definitely movement building. And when I first learned about it, it's actually from a peer supporter here in Los Angeles County, where I am, and that peer supporter himself is a barber. And so he sent me this article about the Confess Project, and he said, "Can we do this?" And I'm like, well, we could do anything. In my book, like, okay, of course there are rules. I get it. There are rules. Like, I'm not the biggest rule breaker, but I was like, yeah, if this is something that you're really interested in. And he started talking to me about, himself as a barber. He has family members who are barbers. And, when folks come into the shop and they're clearly sort of struggling with some mental health stuff, the barbers don't know what to do. Luckily, this peer does, right? Because he works in the system. He's been through all the systems, so he knows how to take time with folks. But the other barbers don't, and generally they're like, "Hey, Charles, come on over here, like help us out." So when he sent me this article, I was like, "Oh, this is like amazing." And then we got connected, and I thought, yes, this is about movement building. It's beyond just training barbers to support the people who come into their shop, right?
Yep,
Like,
yep.
and I think when I go to the beauty salon, I don't even know if that's what they call it anymore. They don't call it the beauty parlor. That's what they called it when I was a kid.
Yeah.
Gonna take us to the
No,
parlor, right? But and it's where the ladies and the men and our young children, would talk about their everyday lives. So what a better place to meet people where they are, and kind of something that we do sort of ritualistically almost as Black folk. We go get our hair done. As I say, we go
yep.
get our hair done dead. That's what we do. So when you came up with this idea for the Confess Project, how much of what you have gone through as a Black male and your own personal experiences led you to think about the barbershop as a place for healing, support, and movement building?
Honestly, again, it goes back to, as a kid, I was separated from my mother and father. They had their own unique challenges, grew up in poverty in the South. Family members beyond that had, incarceration, drug addiction, health issues. And so all of these things are a very magnitude of what we recognize as the public health disparities within Black folks and the things we really deal with. And also, but considering the access and how language and the barriers to insurance and financial means were unable to help them really progress. So
Mm-hmm.
that in itself, I think I was impacted by generational, what I like to say, generational health impact of mental health and even physical health, right? And so when I think about the challenges that I took on from them was really purely around my depression. When you're not, obviously living with your mother and father, and you don't know your siblings, there's a bit of a disconnect there that really creates a level of disparity and despair and hopelessness. And
Mm.
so that in itself really grew to what? It grew to behavior issues. It grew to being kicked out of school, going into a behavioral health facility at the age of 10, losing my mother and father early on, which also just created more delineated issues. And in long term, being incarcerated at the age of 17 for a firearm, joining gangs, the list goes on and on. I was really grateful after my release. A few years afterwards, I went and worked in the juvenile facility as a more of what they call a youth care worker, working with young people. And the next 10 years going to work in behavioral health facilities, just as a mental health tech and a case manager. And I recognized the gaps that we had in our system, the disconnect in care and quality care for Black folks was definitely present. And so seeing that over the years, I didn't know how to respond to it. I didn't really know what it even looked like advocating at large. But recognizing that when I felt that I had the tools getting out of graduate school, that it was time for me to really step into my boldness, not only my story, but to my uniqueness to helping other young Black men and their families that look like us, right? That look like people that are, going through similar situations and being that voice. And so that's how my story and the work that we do at large, I think, is really manifested and really just excited for other people that now can step in their own power. I think it's about our own power and how we take that and how do we use that power. So I think that's what we're now giving to our barbers, is saying that while you're taking this on as an advocate, that you step in your own boldness and power and do other things for other people. And if we can see that happen over and over, then we have a community that is really what we call, what Dr. Martin Luther King called beloved communities. And so I think that's the path that we're headed on, and just really taking it day by day for sure.
What made you think of starting with barbershops? I mean, it seems very natural when I think about it. And I know many years back, it was like a little pilot. It didn't really go very far other than it had some good outcomes. And a lot of people would say, check up from the neck up. And that's kind of what happened in the barbershops and with the beauticians is, while you're getting, your hair and, facial hair and your hair taken care of, you were also getting a little checkup from the neck up around your mental health and well-being. So what actually made you kind of really like almost double down and make this thing happen? It's kind of like, how do you get the spark, and then the spark turns into a fire, and then the fire turns into a flame? So where did the spark come from as far as barbershops and barbers?
Honestly, at first we started off doing this work. I never forget, I had a colleague of mine that, I was like, man, I really want to help Black men. I really want to help support us. And, I had a family member who had recently been diagnosed with bipolar disorder. And just seeing him as a Black man, some of his struggles he went through and some of the challenges that our family went through, and just not understanding what caregiving looked like, what it, compassion looked like at that level, but even how the care looked like. What did that look like because of, your family member being now, backed into a wall, right, with this illness that really could really hinder so much. And so I think that in itself really gave me my real spark, allowed me to step into the power. And I think my first thing is we went to a library, right? We never forget, we put up a sign calling out men to just come have a safe space. And it was about, come confess and talk about, things that you want to talk about. And and talk about the things, and how to really build on mental health. Well, nobody showed up, right? It was 0 participants. And I'll never forget, that was probably the most, devastating, but also I think it was a very uplifting moment, because now that I look back, that's what forced me into going deeper about how do we really reach men. And I thought about the barbershops. And then I thought about, as a kid, I said, wow, my aunt owned a beauty salon. And I just started really reflecting about going there as a kid. My first mentor, Sylvester, who was a barber there, was roughly about 5 chairs there, watching my aunt and them, feed the homeless, do their hair, cut their hair for free if they didn't have the money, and really take care of their community, what we call village care. And I watched that as a kid, getting off the bus every day, going into the beauty shop here at this four-way in an urban community. And the four-way was just as busy and it was just as live as everybody would. There's a lot of other businesses around. So I think that's really where I saw community. And I saw how that beauty shop was a beacon of giving hope into that community. And so that right there was, I think that's what struck me, is because of those participants that didn't show up, allowed me to reflect on my journey and say, wow, let me try barbershops. And whoever would have knew going to do our first shop now turned into, doing hundreds of them, right?
Mm-hmm.
Bringing on thousands of barbers, and the list goes on and on. So we're really, really excited that, sometimes on the other side of what we may see as failure could be opportunity, and
Exactly.
that opportunity really is something that's serving so much impact for individuals, Black men and families, for sure.
Yeah, that is such an important point there, that, a low time, you were able to do deeper reflection to turn it into, like, instead of saying, oh, well, that didn't really work out and leaving it alone, being able to take it a step deeper and deeper to figure out, well, how do I make it work better? And you kind of came up with, I think, some really critical or critically important pieces, which is, a lot of times people struggle with their mental health because of what is a lack of safe space community. I think a lot of people may be in community, but is it a safe space where they can talk about stuff where, they might be shamed for, talking about vulnerabilities, especially for Black men, it's like talking about being, I hate to say, being weak.
Yeah.
Okay, I'm going to be an unapologetically Black unicorn right now and say that's tough for anybody to talk about. But how is it for Black men to find a safe space to talk about those kind of vulnerabilities? And it seems like you tapped into that.
I think the one key thing that I really took on was that I was in a really low place at that point. And I never forget going into a barbershop, and one of the men that was there, that was getting his haircut was like, we go inside of barbershops, while people are in the shop, and, we would do trainings, sometimes on the off days and barbers, and we go inside the barber colleges. And I just remember a gentleman asked, like, well, man, what do you do for your mental health? How do you deal with it? And that really, I had a hard time answering that. And at that point in time, that also led me to start my journey with therapy. And so as I went deeper, that participant there in the barbershop, I never forget, was a part of me really realizing that if I wanted to not only do this as a part of my career and my work, that I also needed to engage in this personally. And so it allowed me to just dive deeper into myself, and it has really allowed me to be very effective in the work that we do, to how we hire other Black men, how we train, stabilize the movement. I think has really been very significant in our culture, hiring people with lived experiences, folks that come from our communities, being very clear that this is how we're doing it and the way we're going to do it. And I think that's what allowed I think even now, allowing the fire to stay as high as it is.
Yeah.
Like you said, it's definitely hard to get men engaged. Even what we do not have a magic pill that is still the way it is. But what we have have practiced authenticity at a high level. Mm-hmm. And I think barbers see that, men see that, people know that we're real, we're serious, this is not a science thing. This is a real thing that really, like, from us, by us. And I think that really goes a long way.
Yeah, I think so. I was thinking about, when you were talking about your barber asking, well, how do you take care of your mental health? As a, mental health advocate for many years, I was going to a new stylist. She started talking about one of her relatives, and she said, yeah, well, she's crazy. We don't know what to do about it. And I'm sitting in the chair going, oh, what do I do? What do I do? I mean, I work in this field of mental health, and she's using derogatory terms. I could get over the derogatory terms. I'd rather she be able to tell it like how she would tell it, rather than controlling her language, to hear where the struggles were. And about the second time or third time I came back, I asked, well, how's your relative? And she said, oh, I'm really worried they're going to, like, pick her up and they're going to, like, put her in jail. And so at that point, I told her what I did. I said, well, let me tell you what I do. And she's like, what? Oh, this is what you do? But, mental illness, that's for white people. That is straight up what she thought. She's like, mental illness, that's for white people. And I know she has her struggles, and, we say that she's crazy, but I don't like the idea that they're giving her medication, or they want to give her medication and call her that she has this mental illness. That's a white people disease. And other people in the salon, the other stylists and the other chairs, and sometimes some of the other people getting services that were there. This is stuff we would just talk about amongst ourselves, so that she could think of it in a different way and think about, okay, don't worry about if it's called a mental illness. What about the struggles that you all have been through as a family, kind of being ripped from your country? And this is somebody who came here as an immigrant, not in the way that they would have wanted. It was war torn and stuff like that. So we had to unpack trauma and kind of use language that she understood to better be able to support her sister, even though within sort of the majority culture, yes, it's called mental illness, but when we reframed it, it was a better understanding.
Yeah.
So, I mean, I think that the salons, again, are such a beautiful place to have the conversation in ways people can talk about it.
Yeah.
So how do you get the barbers and the barbershops actually agreeing to be a part of the Confess Project? And also, what is some of the training that the barbers have to go through?
Yeah, so a lot of it is, on the front end. We're doing a lot of relationship building. Now our ecosystem is so large. We work with, barbers that are affiliated with Andis, barbers that are affiliated with Gillette. So we've definitely now, and I think we've done a lot of hard work to build up ecosystems. We attend barber trade shows, hair shows at large, industry events. So we've definitely done a lot of the groundwork to build our name, I believe, through the pipeline of the barbering industry and the salons industry. A lot of it in the earlier stages, right, is really was, getting our name out there, branding, talking with barbers who had influence. We really honed in on Black key barbers that we knew could reach a lot of more barbers online, barbers offline, barbers who were affiliated in local community events, barbers who were affiliated even in just what we call being cool scene in urban cities, right? And like the who's who, and barbers who worked with celebrities and worked with people that that may have had influence. That's really, I believe, how we got into our community and really were able to reach a lot of people. And so those barbers, made referrals, right? Reached out to barbers that they knew, reached out to other folks, and that really helped us to spread the word. I think some core things that we really cover, very simple, is active listening. It's a core thing we cover in our training, validation, positive communication, and stigma reduction. And so those 4 areas is how we allow the barbers to work with their clients. So in a real time, as they're cutting somebody's hair and they're listening, right? Their client is talking about they had a hard week and that they're stressed out, or maybe they lost somebody to COVID-19, or hey, maybe, life is going good, but I'm trying to get this one thing in my life situated with a relationship, whatever the case may be. They're taught to validate, how to validate, somebody that's going through maybe negative self-talk. I don't think I can do this. Or, man, I'm feeling, so they're taught to validate that person's feelings, right? Making them feel seen and heard. And then communication, positive communication. So, as men, we often may tie into negative nuances around, oh, you're a man, or, suck it up. And so we teach them to not engage into that wording. That is what we lead to is part of the stigma, right? So, and so stigma reduction, right? Ultimately, stigma reduction, just letting them know the key things that are important to not feed into stigma. So that's weak, you're a man, these connotations, white people, mental health is for white people, these terms that are thrown around are sometimes, in fact, the challenges that we are up against in the community. It's really subtle stuff that I think one can make a mere magnitude of difference. And so while we're doing this inner work, and then lastly, we're teaching our barbers how to refer to providers, right? How to give people the resources. One thing that we're kicking off is Barbers for 988 is a platform that we have a website, barbersfor988.com. There's a special shout out to the Sazozi Foundation and the campaign that we're looking to put on to getting out the new 988 number through our barbershops, through our network. Looking forward to providing that literacy and the messaging that our community members need, and so I think that's at large, how we're connecting all those dots.
Yeah, that's really fantastic. And for folks who are not aware yet, or I'm guessing most of my listeners are probably, people who are doing stuff in the mental health space, but just in case, 988 is going to be the new mental health crisis line. So instead of having to remember a longer number, most of us know the 1-800-273-TALK, which is the National Suicide Prevention Line. Now, throughout the nation, because of a federal bill, there will be a 988 number and the National Suicide Prevention Line kind of underneath it, so to speak. But, we have to help people know that that number is out there and that that's a number they can call going live in July of 2022. So just around the corner. So being able to get the word out on the ground through barbers is just fantastic. So I'm thinking like, how do I know that my barbershop has Confess Project barbers? Is there a sign out front? Is there a list somewhere? Like, how do I know?
We're really big on every barbershop we went to have an emblem that we put on their window. We also do add them to our directory. I believe we are, if not already, have uploaded that directory to our website. But if not, people can always reach out to theconfessproject.com and we can obviously have someone in contact with them, about that. So that's one key way. I think another key way is just social media. We're always obviously putting out relevant content. Right now our core areas that we're in Atlanta, we're in Los Angeles, and we're primarily in Arkansas. It's some of our core programming areas, and we do train barbers across the country. But I like to say those three areas have been more of our priorities right now. So we know that we have a lot of work to bite on just with LA and in Atlanta and here even deep south of Arkansas and Mississippi. So I think that's some core ways. But yeah, we definitely try to make sure that we have the Confess Project Barber Coalition. I know with the 988, we're looking to put out more things inside of like posters inside of barbershops. Maybe looking at like some billboard campaigns and some different things that we can really magnify the messaging for getting the new information out about the crisis hotline. So
yeah, that would be really just so fantastic when you're talking about the billboards and posters and things, because I always think about what happens in the Black community is billboards tend to be filled with things that maybe aren't the healthiest for us. We might enjoy them, but they might not be the healthiest for us. But to be able to see, billboards and bus bench placards and things that about the Confess Project, about 988 would be just really amazing because it can counteract sort of that other stuff that we generally see. Just to speak openly, what do we see in our communities? Things for cigarettes, alcohol. I'm just, I'm an unapologetically Black unicorn, so I'm not going to hold back and speak the truth about what we see in our neighborhoods. But so what about and again, I'm not trying to get you to grow your business, but I am trying to get you to grow your business. For us Black women who are going in the beauty salons, do you see yourself at some point going and training stylists in beauty salons as well? Or I know you're trying to hone in on this one thing first. I'm not trying to like diversify you yet.
Yeah, no, you're fine. We're definitely looking to. I think this will be my first time speaking about it publicly. I'm looking at in the next 60 days, 60, 90 days, I've been looking at actually, outside of the Confess Project, starting the salon suites industry is a big industry. One of my goals outside of this was to get into actually developing barbershops and salons as an actual real estate portfolio. And so I'm actually in the phases of developing a salon suite for a pilot. And my goal is out of that to incubate women estheticians into the network, but by providing a space. And I think building that network out. So I think that that's going to be one way. I think the other way is that we definitely already work with quite a bit of stylists, not as many. A lot of the stylists are already inside of our barbershops, some of them. But I do think this new opportunity, really looking to building some connections to that industry more. And so I think that looking to provide some benefits of not only space, but also how we can get them into our network. Yeah. Right now, we're in the middle of an evidence-based pilot program with the Department of Behavioral Health in Georgia. And this grant is going to allow us to gather evidence-based data. And as we show that efficacy is to also go into working with stylists and working with domestic violence victims. And because I think this model can be used in a lot of different ways. Yeah. So a few things that we're looking to do, I think, and so we're already ahead of how do we start that process. And I think one way is just starting to network and really seeing what does it look like, how does that, because I grew up in a beauty salon. So I think for me first, that's what I knew first as a kid. So I think connecting back to that, right? And the barbers was an easy connection because I went to the barbershop, so that was easy.
Yeah.
But I think now learning how do we best serve, Black women, and how do we best really serve them in the best way that's going to be authentic, like we were with barbers and men.
Yeah.
So.
Yeah. Oh, that's just fantastic. And I know you're quite the entrepreneur, so it doesn't surprise me that it would be kind of looking at the supply chain of, well, maybe we don't go in other people's shops and we create our own Swedish shops. Like,
yeah.
It's kind of like you're going to have the whole supply chain kind of, I hate to say, I don't hate to say, but following the Kaiser model. Like if you think about Kaiser, from having the hospitals to the doctors, to the insurance, to the pharmacy, and now actually they have a medical school. So that is the entire.
Wow. That's awesome.
They didn't miss a beat. Right? So if there's like one thing that, you really want to leave people with who are listening in about either, Black mental health, about the journey of Black men, about the Confess Project, like kind of what's that? I always say, what's the wisdom you're going to drop in here? You dropped a lot, but if there's like one piece.
Absolutely.
Absolutely. What would that be?
Something that dawns on me right now, suicide, I believe, it changes often, obviously, but I think right now suicide for Black men and boys between ages 18 and 24 is about, I think it was like third leading cause of death, may have been a second lead. I think it does change here and there. And I understand that suicide in our youth right now has really raised a lot. And that really does something to me personally because I have a young daughter and, also I think the world of young people. I believe young people are the next people that's going to take this forward, right? Our ancestors had to do enough for us to get here. And I believe, again, we're going to have to ensure that our next generation. And so I think what I want to leave with people today is that to just not be remiss of the fact that everybody's going through some kind of challenge, and that I think we should holistically always be thinking of innovative ways to help people and to do it to people and where they are in life. Because I think sometimes, and I think that's where we get tied up in the systems and it's one size fit all, and that's not the case. That's just not what we're doing at this point in life. And particularly in COVID-19, this is just not where we are. And so I think uniquely, I hope what we do is a symbolism to the world that to show up where people are, to do more when you think you've done enough, and to always let people be seen and heard and valued. And in return, I think they will bless you tenfold. And I think the communities will respect you. And I think we'll just have better and safer places to live. And I think overall, that's the energy we put out while we're doing what we do. Right. And that comes back to us. And so I ask people that they do the same, that we put more good in our communities, that it will come back in a good way. So
right. Beautiful. And you're such a good example of that, Lorenzo. So thank you so much for being on the podcast and, yourself Absolutely. Being an unapologetically Black unicorn, and look forward to, continuing to see what happens with the Confess Project moving forward. I have no words. You left us with some great action. Like now I know what I can do as an action step, as well as great information to take care of our mental health and our especially Black men and boys. So thank you very much, Lorenzo.
Absolutely. No, thank you so much.
All right. And for all of our listeners, just remember to join in next week to Unapologetically Black Unicorns.